Hello and welcome. My name is Dr. Jack. Thanks for joining me on this video. For today's video, it was inspired by patients that I have seen over the years who have come to me and they have found relief in some way, shape, or form through hypnosis. And I decided to take a deep dive and figure I'd make a video and share what I have found with all this about hypnosis and whether or not if it's real or is it really like how Hollywood portrays it, where people are able to walk around and cluck like a chicken or howl like a wolf and do all these things and just completely be unaware? Or is there really any substance to hypnosis in general? Is there any medical benefit to hypnosis? For this video, what we will be covering is what is hypnosis? What are the results of hypnosis? What do studies show? And if you were to get hypnotized, what should you expect to have done? As well as talk about some possible side effects and what are the indications of possibly seeing a specialist or a hypnotherapist to see if it could possibly benefit you. So join me as we take a deeper dive into this pretty interesting topic. So let's get started. So what is hypnosis? It's a form of therapy used by various psychotherapists that is not really widely used but often misunderstood. It has been used to treat a variety of issues, and there's evidence that it does help, especially when it is used as an adjunct or in addition to other treatment modalities rather than just by itself. Adding hypnosis to something like cognitive behavioral therapy or other psychotherapies or medications and things of that nature seems to have a better effect than just hypnosis by itself. So anything from quitting smoking, losing weight, chronic pain, PTSD, insomnia, depression, anxiety, and much more, various individuals have described relief from all of these various ailments. And studies have shown that it can help reduce children's post-operative or post-surgical pain, as well as it can be a good adjunct to epidurals and drugs during labor and delivery. And there was a randomized controlled trial in 2007 with smokers who had hypnosis added to nicotine patches. And 20% were found to be able to quit in that scenario versus just 14% of those receiving standard behavioral counseling and just nicotine patches. And in another study, it showed that it can act on multiple brain regions that are associated with physical pain. So let's take a deeper dive into the definition of hypnosis. It is a relaxed state of wakefulness where your heart rate slows down as well as your breathing and other vital signs. And in this relaxed state, your inhibitions begin to fade away because you become more focused on something without letting things like your emotions or worries or doubts interfere or hold you back from acting. And you likely go into these trance-like states throughout the day, actually. Take the example of reading a novel or a book that you're really into, or watching a movie and you're just caught up into it. You find yourself completely absorbed into what you're doing. And the emotions that you experience, whether it's from that movie or that book, actually become very real to you as well. It can make you cry, it can make you laugh hysterically, it can make you mad or frustrated or scared, and all these different emotions can be evoked by these situations. And daydreaming can also be thought of as a form of self-hypnotism where you're basically just spacing out and possibly get lost in just thought. And I'm sure we've all had that situation where you become very preoccupied in some thought and you're going somewhere, whether you're walking, riding a bus or public transportation, or you're driving, and you get there and you know that you drove or you rode public transportation to get there or walked, but you don't recall any of the events sort of in between or any of the details. All of that is similar to a trance-like state that you enter into when you are actually hypnotized. So contrary to the hypnosis that we see on TV, it is important to note that you are alert or always in control of your choices when you are hypnotized. And this alertness is actually what separates it from sleep. A lot of people compare hypnosis to sleep, but it's really an inaccurate comparison, because when you're asleep, you are not aware or alert. You're completely unconscious in that scenario. Versus hypnosis, you are actually fully aware of what's taking place. Now, there are situations where there has been documented what's called hypnotic amnesia. And in those situations, the person actually doesn't recall a lot of the situation that took place. And what happens there is that they're so deeply caught up in their thought in the hypnotic state that they sort of lose grip with reality. And while that sort of may sound scary, but when you enter that very, very deep state, it can actually tap into a person's long-term memory, and that basically makes the hypnotist's suggestions during that time even more profound and more likely to have an effect on you. So during these sessions, the hypnotist or hypnotherapist will guide you into that deep state of relaxation or trance-like state. And while you are in this state, they can make suggestions to help you become more open to change or help you improve whatever issue you are seeking to address. The therapist helps you take control over mental processes that the individual can oftentimes have difficulty controlling by themselves. It's also important to note that only about 10 to 20% of the population is supposedly highly hypnotizable. Children are able to undergo hypnosis more so than adults, and typically you need to go to 4 to 5 sessions before you see sort of a profound effect in those situations. And also, in order to be hypnotized, you have to want to do it voluntarily, and those that really want to be hypnotized are more likely to be hypnotized. Dr. Jessie Kittle, who is a professor of medicine, psychiatry, and behavioral sciences at Stanford, she did a lot of digging in the medical literature dating back many decades, and she found a lot of good clinical outcomes for various conditions. She was quoted as saying that it blew my mind. And in a 2020 study, Dr. Kittle published in the American Journal of Medicine that she felt that Western medicine completely underutilizes hypnosis for pain, headaches, anxiety, and other ailments despite the robust evidence backing its benefits. Another well-known researcher is Dr. Irving Kirsch, who is a hypnotist researcher at Harvard Medical. He has been quoted in saying that hypnosis is not deceptive. It's not trying to trick people or get them to believe something that isn't true. It's helping them believe something that they want to experience. And Dr. Kirsch did a study as well and found that hypnosis combined with cognitive behavioral therapy, the two combined drastically increases weight loss. After about 4 to 6 months, those that did cognitive behavioral therapy lost about 10 pounds, and those that did cognitive behavioral therapy with hypnosis actually dropped twice as much weight at 20 pounds. And what was more profound was that the hypnosis group actually kept the weight off for up to 18 months out, whereas the cognitive behavioral group tended to gain weight. And just so you guys know, I've been working for quite some time now and trying to put together a whole series of videos to help with weight loss and bust a lot of the weight loss myths that are out there. It's really interesting, all the stuff that I've dug up on all of this. So if you're interested in that, make sure you're subscribed and hit the notification bell so that you know when those videos come out. I'm not so sure when they'll come out. It just depends on when I feel like I've done my justice in gathering enough information. Another way to think of hypnosis is that it allows access to your mental machinery that we use to process different situations differently. And as an example, in regards to how each individual basically processes every situation differently based on our perspective. You know, on a given day that I go to practice, I talk a lot about lifestyle, so things like smoking and weight loss and things. And you know, I could give the same talk to 5 different individuals, and I could use the same tone of voice, same body language, same everything, deliver the exact same speech. I could even record it and play it back for those individuals. And all 5 of them might have a different reaction. Some of them might interpret it as insulting and get angry and storm out, while others, you know, would find it appreciative and actually do something about it. And then others may not know what to think in that situation. What hypnosis does in these situations is basically allows to tap into those processes about how we interpret these different types of situations. So how does hypnosis actually work? Well, if you ask 10 different psychiatrists or a psychologist or a hypnotherapist about it, you'll probably get 10 different answers. The truth is that we don't truly know exactly how it works. There was a Harvard study where they looked at areas of the brain that relate to processing and controlling what's going on within your body. And it was shown that there was greater electrical activity in these areas during hypnosis. Areas of the brain responsible for your reactions to situations, as well as the area that's aware of those those reactions appear completely disconnected during hypnosis. So it's a lot more than just a placebo effect, because you actually visibly see things going on within the brain. And if you think about it, in that sense, it is like meditation when it comes to brain function. Meditation is also a state of mind where you become unaware of your surroundings as you focus. And so let's pause for just a second. I'll talk about hypnosis versus meditation, because the two commonly are compared to each other. And if you want to learn more about it, be sure to check out my YouTube video that I did on meditation and why I suggest it and why I think it's great. I think everyone in this day and age should really learn how to meditate. It can benefit you in so many ways, not just in the midst of a pandemic and being at home and everything that's going on in society, but also just in the sense of, the information age that we live in, how we're constantly being bombarded with stimulation. We always have our phones on us, we're always reachable, and we're always on some monitor in some way, shape, or form. And so it's really important, in my opinion, to learn to meditate and allow your brain that time to basically unwind and to just be aware and be present in the moment and to practice mindfulness at all times. So both meditation and hypnosis are trance-like states with similar brainwave patterns, actually. One is typically guided by someone in the case of hypnosis. However, guided meditation is actually becoming very popular, and that's how I got started. In hypnosis, the hypnotist will use well-placed suggestions to help a client enter hypnosis and to focus on their problem, as opposed to meditation or a meditation guide who relies on the client's ability to enter the meditative state themselves. And another thing about hypnosis is that it's there to guide you further and offer suggestions, and is done by a licensed physician or psychologist. So say you listen to all this or you're considering getting hypnotized. Well, what should you expect when you walk in there? There are actually two phases. There's the induction phase and the suggestion phase. And in the induction phase, you'll be asked to focus your mind and to relax. And this is typically done with verbal cues or repetition of words or something like that. The goal is to quiet the mind and focus attention on the therapist's voice as well as guidance. And then during the suggestion phase, the therapist starts talking the patient through hypothetical events and scenarios intended to help them address or counteract unhelpful behaviors as well as emotions. And the hypnotist may help you picture what the future looks like and guide you toward those healthier decisions to make that future a reality for you. And during this time, it feels very real to the hypnotized individual. If the hypnotist suggested that your hand feels swollen, you might feel an actual tingle in your hand. If they suggest that you're chewing or eating ice cream, then you actually might feel a cold sensation within your mouth. And if you're faced with something that is scary to you, you actually could develop physical symptoms associated with fear, like increased heart rate, breathing, blood pressure, and all these types of things. However, again, as a reminder, it's important to bear in mind that during all of this, you are completely aware of what's going on. And at no point can the hypnotist make you do something or say something that you don't want to do. The entire goal is to become more open to suggestions and advice than when you are in your normal state of mind, where you let other thoughts and criticisms basically sway your focus. And for reasons unclear, having suggestions directed towards you during the state helps the brain take in the suggestion and assimilates them in a way that influences how we respond in the future. And then as the session comes to a close, the therapist will essentially bring you out of that trance-like state, or you can bring yourself out of it. However, there are some side effects. People have described feeling headaches or dizzy. They also might feel drowsy, and there's some situational anxiety as well. That is typically seen in hypnosis for memory retrieval, which is quite controversial. In those situations, you're more likely to see anxiety, distress, and these types of negative side effects. You do need to be careful when you're undergoing hypnosis for memory retrieval, because when you're doing that, you are more likely to actually possibly create false memories or things that you think occurred but actually did not occur. So with that, we'll wrap up this video, and I hope you guys found this really interesting. I know I did when I was doing the research to make this video, and it's a really interesting topic. If any of you have ever been hypnotized, or if you're a hypnotherapist, please comment down below. Tell us about your experience. Just educate us. And again, this channel is all about sharing knowledge. So like a lot of the stuff that I research for this channel, I do think that more research needs to be conducted in hypnotism and basically see where it leads us. The human mind is so complicated, and I feel like there's still so many layers to basically unpack and unravel. And we can try a little hypnotism now. Watch the pendulum. be sure and subscribe and like the video and share it with others. So we'll see if that works and if this video gets more likes than previous videos. So till next time, take care, stay safe. Bye-bye. Pura Vida.